New at 10, hospitals sound the alarm on possible further Medicaid cuts. The Senate Finance Committee also recommending deeper cuts to Medicaid in the revisions of Trump's big beautiful bill. Channel 8's Danielle De Silva talked to two hospital groups about how the proposal could affect Nebraskans. Danielle?
Yes, Sophia, what both advocates tell me is that a loss of funding is a loss of programming. And once these programs are lost, they will most likely never return. Jeremy Nordquist, president of the Nebraska Hospital Association, says proposed Medicaid cuts in a government spending bill are an urgent matter.
Yeah, well, the House passed their bill in May. Now the Senate is taking it up, and pretty soon they want to get it to the president's desk. Some say by July 4th. So we are really in a crunch time here.
The bill is still in committee and would need to be voted on by the full Senate. The proposal would require parents with children ages 15 and up to work or go to school for at least 80 hours a month to keep their benefit. The cuts will impact state funding, which will reduce Medicaid reimbursements to hospitals. The results? Hospitals say there will be a loss of programming, and some may have to shut down entirely, which affects not just Medicaid patients.
Okay, we have a lot of politicians out there saying, well, we're not even cutting their benefits, we're just cutting other funding. Well, if the services can't be sustained, the benefits are no good. It doesn't matter if you have the best commercial insurance or you're uninsured, nobody has access to that service anymore in the community.
Rural hospitals say they would be most affected.
For our rural communities, if you were to see a significant cut in those services or in the reimbursement through Medicaid, you're just going to see a loss of those services altogether. And the unfortunate story in all of this is that once those services go away, they just don't come back. And that's what we're really fighting for. We're really wanting to make sure that some of those truly essential services that are available today remain intact into the future.
The president of the Nebraska Rural Health Association urges Nebraskans to reach out.
We can provide information, we can provide stories, but they really do count on hearing from their constituents, from hearing from everyone out in the community on the importance of these programs. And that's really how they end up weighing how their vote is going to be tallied and the impact that their votes have on every Nebraskan.
Jed Hansen was speaking to me from Washington, D.C., and he said that he was on the Hill all day speaking with federal delegates. And although he feels hopeful from his conversation, it comes down to their constituents driving the message home. Reporting from the newsroom, Danielle De Silva for Channel 8 News.